What if I told you that the loss of your physical and mental vigor after 60 isn't simply old age, but the result of a muscular and circulatory knot that you can untangle in a single minute? Think about it for a moment. How many times a day do you feel your energy simply vanish, even after a good night's sleep? How many times have you accepted the decline in your vitality, strength, or potency as an inevitable fate, an unavoidable part of aging? Many men experience a drop in vitality that they mistakenly attribute solely to age. But the truth that science and practical wisdom demonstrate, is that this decline is often rooted in poor circulation, compression of vital nerves, and chronic tension accumulated right at the heart of your core, in your pelvic floor muscles, due to a sedentary lifestyle and chronic stress. Today, we're going to debunk that belief in inevitability. I am Dr. Elena Castillo, and I have dedicated over 30 years to supporting men and women in the prime of their lives. I deeply understand those quiet frustrations that come with age, those mornings when mental fog is thick, or when confidence in your own physical strength begins to waver. I am not here to promise you magic solutions, but to offer you a practical, accessible, and powerful tool focused on a single point that has the potential to reset your center of vitality. What we will explore is a technique that acts as a simple switch for the longevity and strength you already possess. This knowledge is not a passing fad, but a secret of human physiology that allows you to unblock the blood and nerve flow that fuels your daily well-being. You don't have to settle for less energy or less vitality. You have the right to feel strong, clear-headed, and full of vigor at this stage of your life. And the change begins with the decision to massage a single point. Let me explain clearly why this tension in the pelvic floor is so harmful, and why massaging this specific point is not a magic cure, but an act of physiological engineering. When we talk about a decline in vitality or energy, we're not talking about mere wear and tear, but rather a blockage. Think of your body as a complex hydraulic and nervous network. Chronic stress and long hours of inactivity don't simply disappear. They manifest physically. The human body, designed to move and react, interprets work-related stress, financial worries, or general anxiety as a perpetual state of emergency. This triggers the fight-or-flight response, which automatically tenses the large core muscle groups, especially the diaphragm and crucially, the deep pelvic floor muscles. If you spend hours immobilized in a chair, these muscles shorten, stiffen, and become chronically rigid. This rigidity is like a tight knot in a garden hose trying to water your most important flowers. The gauky water that isn't flowing represents two vital elements: blood and nerve signals. Chronic pelvic tension exerts direct compression on essential structures. First, it compresses the pudendal artery, responsible for carrying essential blood flow to the region. If this artery is constantly pinched by hypertonic, overly tense muscles, the body's ability to respond to arousal and maintain firmness decreases dramatically. Second, and perhaps more importantly, it compresses the pudendal nerve. This nerve is the eye-sensory highway that connects your brain to your entire control center, influencing not only sexual function, but also the sensation of fullness and urinary control. By releasing this accumulated tension through the technique we're going to practice, we're untying the knot. It's about giving these vessels and nerves back their space. We're not trying to artificially stimulate them, but rather to unblock what modern life has obstructed. The region we will focus on is the point where its power and stability converge. In traditional Chinese medicine, it is known as the Palace of Energy, but for practical purposes, it is a muscular area that acts as an anchor for the pelvic floor. This point, often ignored or avoided due to embarrassment or lack of awareness, is the master switch for lower circulation. I've seen this simple act of release change lives, not only restoring confidence and intimacy, but also improving sleep quality, reducing lower back pain that many assume is a part of aging, and even sharpening mental clarity. When the center is blocked, the whole system operates with the handbrake on. Now, you might be wondering, what is this point, and how do I find it? You don't need to be a physical therapist to perform this release. It's an accessible point. but it does require a little attention and firm intention. We need to locate the source of the compression, which usually feels like a taut string or a painful, dense spot, very close to the muscle insertions of the perineum and inner thigh. This is where the muscle has literally become rock hard. By applying pressure and movement to this spot, you're sending a powerful relaxation signal to the nervous system, telling the muscles to stop fighting. The immediate response is usually a sensation of warmth, a slight tingling, or a profound relief. That sensation is the blood returning to its normal flow. It's the nerve signal getting back on track. It's not an unpleasant feeling, but rather a welcome return to vigor. Many men come to my office convinced they need complex medications or surgery. My first piece of advice is always the same. Before seeking external solutions, let's see what we can release from within. Stop carrying that tension your body has been accumulating for decades. Imagine you have a rusty hinge. You can force the door, but you'll only break it. What you need is oil. This massage is the oil that lubricates the central hinge of your body. It's a technique that takes just a few minutes, can be easily integrated into your self-care routine, and has an extraordinary cumulative effect. Now, let me walk you through the simple technique to get started. You need a private moment, a comfortable place where you can be semi-reclined or seated with support, allowing your pelvic area to be relaxed and accessible. The exact spot, as we mentioned, is in the center, the junction between the scrotum and the anus. Think of it as the eye of that central hinge that needs lubrication. We'll use the pad of your finger, index or middle, whichever feels strongest and most comfortable, and a little oil or lubricant, if you prefer, although it's not strictly necessary if your skin isn't too sensitive. The key isn't brute force, but steady pressure and intentional breathing. Begin by applying gentle pressure, locating the tendon or muscle that feels tightest, like a finely tuned guitar string. At first, the pressure may evoke a slight discomfort, a sensation you may have been ignoring or suppressing for years. That initial discomfort isn't damage. It's muscle memory of stress and compression being released. It's a sure sign that you've found the right area of restriction. Maintain the pressure. It's crucial to understand that at this point you shouldn't push aggressively, but rather hold the pressure firmly and patiently. Allow your body to surrender to that pressure. While holding it, begin to breathe deeply, sending the air into your lower abdomen. Breathing is the fundamental vehicle for relaxation. With each exhalation, you give your nervous system the command to lower its guard, to release that taut rope, visualizing it loosening by a millimeter. After about 30 seconds of sustained pressure, when you feel the tissue begin to give slightly, you can begin a very subtle movement, such as a small circle or a minimal sideways glide. This movement helps to unstick the layers of connective tissue, the fascia, that have adhered and hardened around the vital nerves and blood vessels that supply the prostate and corpora cavernosa. This fascial release is critical for the reset. Consider a patient I had, Mr. Ricardo, a project manager. His life was ruled by stress and deadlines. When I told him about this technique, he looked at me skeptically. He was looking for the little blue pill or a quick fix. I asked him to dedicate just 3 minutes each night to this self-care ritual. At first, he told me it was uncomfortable, even painful, and that he felt a sharp pain when he applied pressure. But he persisted, focusing rigorously on his breathing as he applied the pressure. Within a few weeks, Ricardo reported not only a noticeable improvement in his function and vitality, but also a dramatic reduction in his chronic tension headaches. Why this systemic effect? Because the tension he accumulated in his pelvis wasn't just a local problem, it was the physical manifestation of his core anxiety. By releasing the nerve center, he released the entire system. This point is crucial for a man's overall health. We're not simply improving blood flow or nerve signals. We're dismantling, layer by layer, the physical and emotional armor we've built around our masculinity and our stress response. This armor manifests as tight muscles, restricting life and vigor. The perineum is the gateway to that restriction. By opening that gateway, we allow the body to remember its natural state of relaxation and functional capacity. The cumulative effect of this consistent practice is what distinguishes a temporary improvement from a lasting transformation. And there's no age limit to begin benefiting from this release. The results often surprise even the most cynical. Let's talk about the vital pump effect, the hydrodynamic mechanism that transforms an area of stagnation into an engine of renewal. Imagine the perineal muscle tissue, and indeed much of the pelvic floor, as a sponge. If this sponge is permanently tense, squeezed by chronic anxiety, a sedentary lifestyle, or rigid postures, the flow of fluid stops. The muscle slowly drowns in its own metabolic waste, primarily lactic acid, and is deprived of the fresh oxygen supply it needs to function properly. Perineal massage, when applied with the correct technique and intention, is not merely a superficial stroke. It is a rhythmic compression and release, like gently squeezing a sponge. When we apply pressure, we force out that stagnant, toxin-laden venous blood. When we release the pressure, the vacuum created immediately draws in fresh, oxygenated, nutrient-rich arterial blood. It is a local infusion of life and vitality. This cycle of cleansing and renewal is absolutely crucial, not only for erectile function and sensitivity, but also for the long-term health of the nerves and vessels that run through that region. Well-nourished and oxygenated tissue is, by definition, resilient and functional tissue. This purifying effect is what allows the third mechanism, indirect prostate support, to be so effective. We must be very clear. This self-care technique is not a direct medical prostate massage, but rather a preventative and decompressive support. The prostate sits right in the center of this region, surrounded and supported by the pelvic floor muscle complex. If the surrounding muscles are in a state of chronic hypertonia, rigid and tight, they exert constant external pressure on the gland and its delicate ducts. This mechanical pressure is a source of irritation and can contribute to uncomfortable symptoms that are often mistaken for purely infectious or structural problems, such as chronic pelvic pain syndrome, formerly known as non-bacterial prostatitis. In addition to pressure relief, the improved circulation resulting from the pumping effect minimizes local blood congestion. This congestion, this stagnant metabolic sludge, exacerbates inflammation in any internal structure. By releasing tension in the surrounding tissue and facilitating venous drainage, we help the body reduce the inflammatory burden and eliminate irritating byproducts. I think of Miguel, a 55-year-old patient who came to my office frustrated. He had endured a long ordeal of urological tests because he suffered from constant lower abdominal pain and frequent, uncomfortable urination. But all the cultures came back negative. Its origin was, as we suspected, muscular and nervous. By releasing the tension accumulated in the perineum, we not only eliminated the mechanical pressure irritating the prostate, but we also activated the parasympathetic branch, our fourth mechanism of action, which reduces the pain signal from the central nervous system. In just 3 months of consistent practice, Miguel reported that his pain episodes decreased from daily to occasional. And what surprised him most was the improvement in the quality of his sleep. When the body's core relaxes, the brain finally allows itself to rest. This is the power of treating the body as an interconnected system, where the solution to a pelvic problem can, ironically, be the cure for insomnia or anxiety. It is crucial to understand that these mechanisms do not operate in isolation. The nerve decompression that reduces ecstatic is enhanced by the oxygen that enters thanks to the pump effect, and both effects are profoundly amplified by the activation of the parasympathetic nervous system, the rest and digest switch. When we get the body into this state of deep physiological rest, healing becomes the natural state of being. We are not forcing the body to heal. We are removing the obstacles that were preventing it from doing so. We are creating the space, both physical and biochemical, for health to flourish. We've grasped the science behind healing. Now, we must translate that knowledge into practical action. The key to this technique is consistency and the correct application of pressure. I want you to approach this practice with the same curiosity and patience you would use to learn to play a musical instrument. The technique itself is simple, but it requires attention to detail. Let's start with positioning. There are 2 main methods I recommend. both designed to relax the pelvic floor muscles and allow for comfortable access. The first method is to sit on the edge of a firm but comfortable chair. The chair shouldn't be too high. Allow your feet to touch the floor with your knees bent at a 90-degree angle. If you're using an office chair, make sure it doesn't have wheels or that they're locked, as stability is crucial. The important thing is that your weight is slightly forward, gently tilting your pelvis to expose the perineal area. This position is ideal for those who have difficulty lying down or for those seeking quick stimulation throughout the day. The second method, and the one I usually prefer for initial practice, is to lie on your back on a firm surface. A rug or mat is sufficient. Bend your knees and keep your feet flat on the floor. This position is the most relaxing, allowing gravity and the natural relaxation of the hip flexors to release tension in the pelvic floor. This release facilitates deep activation of the parasympathetic nervous system, making it ideal if your primary goal is to reduce anxiety or improve sleep related to your pelvic condition. Once you're in position, either sitting or lying down, the next step is to locate the stimulation point. This point is often referred to as the central erogenous zone of the perineum, located right on the midline base in front of the anus and behind the scrotum. It's not the pubic bone. It's an area of soft tissue where many important muscle fibers cross and anchor. You can use the pad of your finger. The index or middle finger are usually the easiest to handle. The key here isn't brute force, but controlled firmness. I always tell my patients, think of this pressure as if you're testing the ripeness of a juicy tomato. You want to press hard enough to feel the resistance inside, to notice that it's soft yet firm, without bruising or puncturing it. The pressure should be firm enough to be felt deep inside, in the tissue where the knot of tension resides, but never sharply painful. If you feel a stabbing pain, you're pressing too hard or in the wrong place. The sensation should be a tolerable discomfort, a dull ache, or a deep stretch. On a pain scale of 1 to 10, it shouldn't exceed a 4 or 5 in intensity. This is the difference between release and injury. Once you've found the point, you'll often feel a slight tenderness or a radiating point of tension. Maintain pressure for about a full minute. You can choose to maintain steady pressure or use gentle movements. 2 movements are highly effective. The slow, circular rituals motion, as if you were gently polishing the point, or the pulsating turward motion, pressing and releasing rhythmically. This rhythmic movement is what maximizes the pump effect we discussed, promoting blood and lymphatic flow. Don't rush it. A minute may seem long at first, but it's the minimum time needed for the deep muscle fibers and nerve endings to respond and begin depolarizing. While performing the stimulation, it's vital that you don't hold your breath. In fact, your breath is your